I had been telling some patients for a year or two, well, if you don't want to travel to New Orleans, my niece is going to be here. Did I tell you about her? So this is a doctor who's actually she's my niece, but she's also specialized in Parkinson's disease and tremor.
It's always kind of been in the plans, to be honest. As soon as I chose neurology as a field, which Dr. Huddleston played a big part in, I always knew that I wanted to work alongside her.
It is amazing to have, first of all, a peer physician in neurology here, and also to have her specifically as the peer physician who is just family, and we have so much in common. We have a lot of things that resemble each other, and it's just a joy. She does a wonderful job. I'm so proud of her. And then two more at the top. You ready? Sorry. I have had patients for years who I've been treating here on the Bayou for their Parkinson's or tremor, and there are more things that these patients can benefit from when they see Sarah.
Good morning. Hey, I'm Dr. Breaux. Nice to meet you. The initial plan was to do both general neurology and movement disorders here in Raceland. But so far, there's been such a need for movement here that I've seen primarily Parkinson's disease, a couple of essential tremor patients. But more than anything, I'm seeing patients that are kind of reaching that point in their disease where deep brain stimulation is a good option. It's really, really good for patients predominantly with tremor, but it can help a lot for rigidity and things like that too. Being able to actually have a talk with them, actually bring some of my supplies down here, show them the models, the different, walk them through the whole process, brings a lot of hope to the patients, and then also telling them, hey, once you get this place, I can also program you here. You won't have to travel all the way to New Orleans to do that. That's also a big relief, and I think it opens a lot of doors for these patients, especially even some of the ones that felt that they were kind of at a dead end.
When I asked Jamie where she plans to practice after she graduated and did an internship, she says, I want to go back home. And I said, that makes us very, very proud.
Our family has a ton of medical providers. My mother is a psychiatric nurse by trade. My grandmother was a nurse. My aunt is a nurse. This aunt is a doctor. I mean, lots and lots of medical professionals in the family. So I feel like it's something within us that we just really like to help others. We're very passionate people.
That's Sarah in the front. And that's her here.
We're proud that Sarah went to do this. I never would have thought, she'd have gone into neurology, but evidently she was interested in it more than we even knew,
In South Louisiana, we're very prone to hurricanes, and the Bayou region especially is extremely resilient. That kind of resiliency around here translates really well into medicine too. Our colleague physicians at St. Anne's, including our primary care doctors, our OBGYNs, our psychiatrists, they work hard. They work hard like the members of the community do. It's what the community expects of us, and it's kind of what a lot of us were born and raised and taught, that when you're at your job, you give it all you can.